Hello. Flu season is upon us, and unfortunately, it's also during the COVID-19 pandemic. Dr. Emily Godbout, infectious disease expert at CHOR, is here to answer some important questions about the flu shot and how you could prevent the spread of the flu this season. Thanks for joining us, Dr. Godbout.
Thank you so much for having me.
So the first question is a common one that we get, but why is the flu shot so important this year?
So this fall and winter, unlike last fall and winter, we will likely be seeing both influenza viruses and the virus that causes COVID-19 circulating in our community at the same time. So now more than ever, it's really important to get the flu shot to not only protect yourself, but your children, your family, and your community as well. So we're still in the middle of a global pandemic. Reducing the overall burden of respiratory illnesses is really important to help protect those vulnerable populations who are at risk for severe disease, but it also helps lessen the resulting burden on our healthcare system, which is really important throughout the COVID-19 pandemic.
Yeah, and who should be getting the flu shot?
So the flu shot is recommended every single year for everyone 6 months of age and older.
Okay, and you get it once per 12 months, that's right?
Yes, so you do get the flu shot every year. Unfortunately, there are so many different flu viruses and they're constantly changing. The U.S. flu vaccine is reviewed every single year and updated to match the circulating flu viruses. And the flu vaccine can typically protect against 3 or 4 different viruses. And so each year the researchers go through and decide which they think will be the most common for the following year. And since the virus changes significantly from year to year, immunization or natural infection from the previous year is not protective. Furthermore, our antibody response, that's what helps us fight the virus, can decrease over time. So another dose will help boost the antibody response before the start of the influenza season.
Okay. And when is the most important time of the year to get the flu shot? Like, when is it most effective for kids and families?
So it's a great idea to get the flu shot right before flu season. So September and October are really good times to get vaccinated. And ideally, you would get the flu shot or the vaccine administered before the end of October. We will continue to offer the flu shot throughout the fall and winter as long as we still see that the flu vaccine is circulating in our community. But ideally, we want to try to see people get it by the end of October.
Okay, great. We'll be sure to be spreading the word on that on social media and our website as well.
Mm-hmm.
And can I get the flu even if I do get the flu shot? Is it going to prevent me from getting it?
So the flu vaccine typically prevents about 70 of every 100 people who receive it from developing moderate to severe flu infection. This means that the flu shot does not prevent all cases of flu. Even though the vaccine might not completely prevent influenza infection, it can help prevent you from getting really, really sick from it, and it can also help prevent you from having to go to the hospital for it. And just because you get the flu shot, it doesn't mean that you can get the flu from the flu shot. I hear that a lot from people. The virus is inactivated or there's certain protein in it, so it can't actually cause the flu infection after you get the shot.
That being said, is it still common for people or kids to feel like a little under the weather after getting the flu shot? What is that? What should parents know?
Yeah, so sometimes after the flu shot, you could potentially have a low-grade fever or a little bit of achiness, but this is not due to infection from the flu.
Okay, great. And is the flu shot this year going to protect anyone from COVID-19 or the spread of that?
So as of right now, we don't have any data to suggest that getting the flu shot will protect us against COVID-19. But as we sort of already mentioned, the flu shot can have so many important benefits, reducing the risk of getting the flu, reducing how sick you could get, and then also reducing people getting hospitalized with flu. So there's a lot of good reasons to get the flu shot.
Yeah, definitely. And we all know that COVID-19 and flu both have a lot of overlapping symptoms. So if a parent feels that their little one might have either one of those, how do you determine if they should get tested for the flu or for COVID-19?
So you're exactly right. The flu and COVID-19 can have a lot of very similar symptoms. So it can be really difficult to differentiate between the two just based on symptoms alone. So we might be in a situation this fall and winter where we might need to get tested to help us figure out exactly what is causing someone to be sick.
And can we expect that either if it's an urgent care or a primary care physician, that if a patient is presenting with both of those symptoms or overlapping symptoms, that they might be tested for both?
Yeah, so I think there is some promise that there might be some more tests coming out, potentially even one test that could test for both.
Oh, wow.
We'll just have sort of what reagents are available and what tests are available. But ideally, we would have one test that could potentially test for both. That might not be available at every single office and every urgent care center, but the ability to test for flu is available very rapidly at lots of doctors' offices and urgent care centers.
Yeah. So will wearing your mask, hand washing, social distancing, all the things that we've been enforcing and talking about during COVID-19, will these also help prevent the spread of the flu?
The practice is currently in place to help protect us against COVID-19. All the things that you just said will probably help decrease the spread of influenza. In fact, early data coming from countries in the southern hemisphere actually suggest lower than usual rates of flu. While this is certainly good news, things could be different for us here in the northern hemisphere where we live, and we don't have a crystal ball to help us predict exactly what our flu season is going to look like, but it's really awesome that we're all going to be very well prepared with all the infection prevention strategies that we learned. I don't know about you, but I feel like I'm a professional hand washer now, and children are, my friends are, so it's really good that we maintain all of those things. But what's great is that we have this added benefit of having the flu vaccine. So it's really important for us right now to start thinking about getting the flu and planning for our children to get the flu vaccine and our other family members as well.
Yeah. So keep wearing your mask, keep washing your hands, keep your distance, and then get the flu shot, of course.
Yes, yeah.
Awesome. Is there anything else that you wanted to add?
Just a couple other things. People often ask if they have an egg allergy, can they still get the flu shot? So if you do have an egg allergy, you can still receive the flu shot. It is suggested that people with egg allergies remain at the provider's office for about 15 minutes after you get the vaccination. And a lot of versions of the flu vaccines are made in eggs, and some people can certainly have severe allergic reactions to eggs. But the amount of egg protein that is within the flu vaccine is really, really small, and it's typically insufficient to cause a severe allergic response. And then the other thing I just want to hone in on is that the flu shot is very safe and it's very effective at helping prevent severe disease and hospitalization. And it's just such an important step for us all to take to help protect ourselves and our family members and our communities, given that we're in the middle of this COVID-19 pandemic. And I know a lot of people might have reservations about coming into the doctor's office, leaving their homes to come in to get a shot. But I can assure everybody here that our providers are really vigilant about taking the appropriate precautions to make sure that you are safe, that your children are safe, because at the end of the day, we also want to make sure that we're safe and that we're safe for our families and our children as well.
Yeah. Well, thanks, Dr. Godbout. If anyone has any questions related to the flu vaccine this year or where you can get it locally in Richmond or at Chore itself, just leave them in the comments below, and we'll do our best to get back to you within the week.
Thank you.